Hello everyone, Dr. Fink here. Welcome back to the channel. Today we'll talk about a very controversial topic, which is site injections. Okay, site injections used in bodybuilding to make muscle look bigger. Do they work or not? We will cover all of this in a second. A quick disclaimer, this is not medical advice, this is entertainment only. Many of you heard about site injections, which sounds very interesting. So if somebody's about to inject steroids anyway, why inject them into the butt instead of injecting them into the bicep or tricep? Okay. Many people don't want a bigger butt, but they want a bigger tricep or a bigger bicep. Okay. So wouldn't it make sense to just inject right where we need the muscle to grow? Well, the short answer is no. And here is why. Okay. Let's say we inject it into our bicep. Okay, then we will have a little swelling, a couple of days, there's inflammation occurring, the oil, so anabolic steroids are usually is in oil, okay, and this oil will then be absorbed by the muscle and then it will disappear, okay? So this inflammation will last probably a couple of days. So the sensation somebody who practices site injection feels is more inflammation and the localized oil that is there for a couple of days, okay? But after that, it completely resolves, okay? So, but what can happen during a site injection? Since we have much more nerves and blood vessels in these small muscle groups, such as the arms or the calves, for example, the risk of injecting in a nerve or a blood vessel are much higher, which leads to increased risk of infection, nerve damage, and also scar tissue. Okay, let's say you always inject into the bicep. After a while, there will be a lot of scar tissue buildup in the bicep, and it will be very hard to inject first, but scar tissue also prevents muscle to grow up, to grow as it wants. Okay, so those are the risks. So, of course, rotating injection sites to prevent scar tissue, on the other hand, are a good thing. For example, if somebody always injects in the left deltoid, after a while he will probably build up some scar tissue in the left deltoid. Okay, so rotating left, right, or left, right in the buttocks, that could make sense. Okay, but if somebody directly injects into a small muscle group, since it's small, the buildup of scar tissue is also much faster, and the risk of, again, nerve damage or injecting to blood vessels is also very high. And the effects, there's no real muscle building effects, just a volumization for a couple of days and inflammation, and then it's over. So it's basically nonsense. Okay, you're just putting yourself at higher risk for infection and scar tissue buildup. On the other hand, let's say you inject Synthol. Okay. Synthol is not an anabolic steroid. It is just oil, okay? So that person injects Synthol into the bicep. Let's say 10 cc's, 20 cc's, and not like steroids, this Synthol oil will stay in the injection site, okay? And it will look like a lump. If it's done wrongly, it will look very bad and nasty. And if it's done good, it can make the muscle look full, okay? And what happens here, the oil is not absorbed or very slowly. And this can lead to abscesses and masses that can also lead to infection, okay? And they might need to be removed surgically, okay? Or it cause systemic infection, which are very bad health risks, okay? So these are the risk with Synthol. So Synthol does not build muscle, it just puts oil which stays in that area and makes it look fuller, but you cannot control how Synthol is going to stay. It can look very weird, especially if somebody uses a lot of Synthol, okay? So not recommend at all. Synthol will eventually cause health problems, as I just mentioned, and you cannot recontrol the aesthetics of how it will look. Okay, and side injections again associated with higher risk for infection, nerve damage, etc. So either way, injecting into the small muscle groups is not recommended at all. Okay, so keep that in mind. And side injections are not a miracle way to increase your arm size. Okay, hard work, nutrition is always better, and the use of Synthol and anabolic steroids is not recommended at all. I hope you like this video. Please comment down below, and thank you for watching.